Hello again, and thank you for returning for our tutorial. Today we're going to talk about Part D, prescription drug. Once again, you have our information. Please get in touch with us. We can talk one-on-one about available plans. We'll talk about your needs and how we can find the best plan to meet those needs of yours. So Part D, prescription drug. Medicare beneficiaries across the nation have the option of enrolling in Medicare Part D to get help with their prescription drugs. If you have original Medicare Part A and Part B, Medicare Part D is not automatically included, so you must enroll in a standalone Medicare prescription drug plan that works alongside your original care. If you decide to go and take the Medicare Advantage Part C program, you can get prescription drug benefits by enrolling into the program. These plans gives you the option to get your Medicare health and prescription drug benefits covered under a single plan. Always remember that original Medicare does not administer the prescription drug program. It is only through private insurance companies that are contracted by Medicare. It is actually the day after the ending of the annual election period. So from that date throughout November 30th, which is almost, how many is that? Over 38 days, you can make that change once a year only. Now, the Center for Medicare and Medicaid Services has posted a very helpful article, and you are able to click that, find that article in our resources section of the Nebula Insurance Learning Center. Now, whenever you are enrolling into a prescription drug plan, one of the key things you have to do is to look at the drug plan and check the formulary, which is a list of drugs that the plan itself carries as approved drugs, and if you are on prescription drug already, make sure that your drug is listed there. Please be careful because some plans prefer generic drugs rather than brand names prescription drugs. So you must make sure that is there before you enroll into the program. If you have any questions or you have any issues, please contact me so we can help you make sure that the prescription drugs that you're taking are in that formulary. Now, let's say that you enroll into the prescription plan and your prescription drug is part of the formulary, so you're good to go. 6 months later, you go back to your doctor, and your doctor tells you he needs to change the drug because this generic drug is not working, and he go ahead and prescribes a brand name drug, prescription drug, and it happens not to be in the formulary. So you ask yourself, what do I do now? Well, you can submit an exception request to your Medicare plan by phone or in writing, and the plan must respond with its decision within 72 hours of receiving your request. Unfortunately, if they disapprove it, you may have to, unfortunately, pay for its cost. Keep in mind that average premiums for Medicare prescription drug plans may vary widely. One plan may require a $15 monthly premium, while another may require a $100 monthly premium. So as you can see, it is important to shop around, and there is no one like your agent to help you with that, especially independent insurance agents that have dozens of companies that they can check for plans that include your prescription drugs and they are within your budget. Now, Part D also has a late penalty enrollment just like Part A and just like Part B. So, once again, please make sure that you sign up during your eligibility period. Now, if you wait to enroll in Medicare Part D and go without credible prescription drug coverage, which is insurance that is expected to pay an average as much as the standard Part D benefit, for 63 days in a row or more, you may have to pay a higher premium when you sign up for Part D later. So basically, if you don't have creditable prescription drug coverage for 63 days in a row, so on day 63, if you go ahead and sign up for Part D, you will pay a penalty. So how much is the penalty? Just like Part B and Part A, it depends on how long were you without creditable prescription drug plan. But in this case, it's for every month. If you remember, for Part A and Part B, any penalties were for full 12 months after your the eligibility date that you could have had Part A and Part B. In this case, Part D is every full uncovered months that you were eligible but didn't join a Medicare drug plan and went without other creditable prescription drug coverage. 1% of the national base beneficiary premium. Now, how they come up with that, we do not know. Just know that it is there. You have to pay this penalty for as long as you have a Medicare drug plan, even if you switch plan. So in this case right here, this is a chart. If you remember, Part B premium $161.50. Now this is not 2015 numbers. It is if you remember. Okay, yes. I'm sorry. 161 here. If you're making more than $85,000, your premium is higher. Less than $85,000 is not there, but it's $102. And for Part D premium, you pay $12 and such. If you look at the chart, the higher your income is, the higher the premium is, and that. Okay, so what else besides the premium do you pay? Well, you pay a co-share of the prescription drug cost. So you're going to pay your part and the plan pays the rest. Now, there are three phases. The first phase is called the initial coverage phase. During this phase, cost sharing, which is you, is typically 25% of your total drug cost until you reach a spending limit, and for 2016 is $3,310. Now, this cost is whatever you pay out of pocket plus whatever the plan pays combined. Once you reach 3,310, you reach what they call the coverage cap or the donut hole. When your total drug cost exceeds $3,310, your cost sharing will increase to 45% for cover brand name drugs and 58% for generic drug. and the government will assist you to pay by paying the rest. And this is going to be this discount will gradually increase each year until 2020, where you should not be paying any more than 5%, and that will definitely help a lot of people. Okay, so when you reach the coverage gap, and you're going to be paying 45% for brand name and 58% for generic drug names. Then what happens is that your cost plus the government cost put together reaches $4,850. Then you have gotten yourself out of the donut hole, and you go into catastrophic phase. Your cost sharing at this point is the greatest at 5% of the covered drug cost, or $2.55 for covered generics, or $6.35 for covered brands. Now that's for 2015. For 2016, the numbers are $2.95 and $7.40. So it's very important here that you keep track of what you spend. That way, you know when you start getting out of the donut hole. Okay, and that's pretty much it for Part D. So basically, for the Medicare section, we have completed Part A, Part B, Part C, Medicare Supplement, and Part D. And these tutorials, all these tutorials together, they should have given you a good idea of the whole program. Um, add this plus your Medicare and you manual 2016, and you pretty much have a great coverage and knowledge of the whole Medicare program. I'm going to be making some tutorials on specific topics such as Medicare Select, which is Medicare savings accounts, health savings account, uh, Medicaid, and I may expand on some specific topics regarding all the parts that we have already went through. But until then, I want to wish you a good day. Please, we're here to help you. Give us a call. Let's evaluate the program you have now. We have agents waiting for you to call. Give us an ad. Give us a call and send us an email, and we are ready to help you. Once again, from American Senior Savings and Naval Insurance, have a great day. Goodbye.